We hear a lot about the welfare state these days, from people who like the idea and from people who don't. In the next 30 minutes, you'll hear more about it in an on-the-spot report specially documented for tonight's edition of Cross Section. What is the welfare state? How does it work? Is it practical? In Canada, we hear a variety of conflicting opinions. Only this morning, for example, as the office staff assembled to begin a fresh day's work.
Good morning, Frank.
What's good about it?
Say, how gloomy can you get? Haven't you got your dates mixed, pal? This isn't Monday, you know. It's Thursday.
Oh, cut the bright patter and take your sunshine somewhere else. Sure, I know it's Thursday. Yesterday was Wednesday. How could I forget it?
What was so unforgettable about Wednesday?
Well, my wife had a talk with the doctor yesterday. He says she's got to have an operation.
Oh, anything serious, Frank?
Well, we're not really worried about the operation, Bill. The thing that bothers us is how we're going to pay for it. Specialists are expensive, and not only that, but Grace will be out of action for 2 or 3 weeks. That means hiring somebody to look after the kids.
Well, bank account's just about dry, Frank, but you're welcome to my few bucks if it'll help.
Well, thanks, Bill. But what I need is a few $100.
What you need is health insurance. Too bad you're not in Britain now. Your worries would be over.
There you go again, you and your socialism. Join the welfare state and let somebody else do my worrying for me. No thanks. Somebody else would end up doing my thinking, too.
Call it socialism if you want. To me, it's just plain common sense. Frank, the welfare state
The welfare state. The welfare state. The handout state's a better name. Look, Bill, Santa Claus is okay for kids, but you ought to know by now, you just don't get anything for nothing in this world.
Not something for nothing. You pay for what you get. You contribute. Everything's on a business-like insurance basis. But when you need it, you get your money back.
Or your freedom refunded. Tell me, what do you get for your money?
Cash benefits. For unemployment, sickness, maternity, old age, injuries on the job. Sure, they're free when you get them, but they're not handouts. They come out of your own contributions and what other people have paid in.
And you go on paying until you're dead, or broke, or both.
Oh.
Look at the taxes the British are stuck with. They're spending about a third of their budget on social services. It's got to the point where it doesn't pay a man to work. There's no incentive, no room for initiative anymore.
Well, they've got more security than they've ever had before.
That's the trouble, Bill. They've got too much security. It's dulled their ambition and their enterprise. The middle class is all strapped up in red tape, and the working class sit around and take handouts for everything. It's a slave state, I tell you.
Nonsense. You've been reading too many editorials.
The government hands out free teeth and free wigs paid for with other people's money. And nobody cares whether he ever does a decent day's work again.
You don't know what you're talking about.
Oh, don't I?
No, you don't. Look, Frank, it's all very simple. The whole idea is to make sure that nobody in the country falls below a minimum basic income and standard of living. I can't see why you're so hostile anyway. You could sure use a bit of health insurance at the moment.
Wouldn't do me any good. From what I hear, it just means you can't get a doctor for love or money. After putting up with endless queues at the hospitals all day, the doctors are too tired to look at you when you do get in. No, sir. You can have your welfare state.
When last seen, Bill and Frank were still arguing. The question remains, what is the welfare state?